And good morning, I'm Dr. Deuk Laser, CEO and founder of Deuk Spine Institute. We are here with live surgery, laser spine surgery, cervical C5-C6, C6-C7. Our patient travels from Colorado. He's had neck pain and arm symptoms on the left arm with numbness, tingling, weakness for 3 years. It is October 8, 2024. We have just accessed his neck. He has a very thick neck, like a football player. Look at the x-ray. You can see, You can see on the x-ray that there's the needle tip, which is just past midline. We're entering the disc at C5-6 first. We'll start with 5-6, then we'll go down to 6-7. You can see the endotracheal tube and a wire in the esophagus. So we've got the endotracheal tube and wire in the esophagus. Both of them are deflected, and the needle is going lateral to them and medial to the carotid sheath. Okay, let's get a lateral view. There we go. So 2, count for us, Jordan. Nope, it's 2 overexposed. Count, take it again. It's just overexposed. This is a very difficult case because of the girth of his neck. Not sure what you're doing there, Jordan. Shot. Yeah. All right, we're trying to get there. But you can see the number 2 bone, 3, 4, 5, 6. So we are at C5-6. You can see the needle there. We're going to do a discogram. He has a pretty good size herniation here, shot. And he has a herniation at C4-5 as well. And we're just treating 2 herniations per patient's request, but you can see the dye leaking out through the tear in the back of the disc. That tear is where the neck pain comes from. It is the most common cause of neck pain. 90% of neck pain comes from the tear in the back of the disc. That was discovered by me at Deuk Spine Institute about 18 years ago. We even published our first publication on this procedure in 2012. All right, let's see. We've got our needle in, our guide wire in with our needle. And I am probably touching the back. I'm shot. All right. Let's do our skin incision. We're going to numb up the skin. The whole surgery here, the Deuk Laser Disc Repair, is what it's called. It's peer-reviewed and published, FDA approved. And everything's done with a 4mm skin incision. So there's no need to open the neck up like other types of surgery, which are more dangerous. As a matter of fact, ACDF, anterior cervical discectomy infusion, the most common treatment for herniated discs in the neck, like this patient has a 50% complication rate. This surgery we've had 0 in 18.5 years. Shot? All right, at this point I have to remove the needle but leave the guide wire. Shot? So I'm taking some x-ray pictures. I see the guide wire, I see the needle. Shot? So the needle is coming out, guide wire is staying in. We're going to use this guide wire to bring in what's called a dilator. It's like a skinny little metal pencil. You can see the tip is tapered. Henry, you see that tapered tip?
Yes, we do.
And thank you, Luis. And the tip is actually 4mm or 3mm wide. Actually, just under 3. It's 2.8mm. So I'm going to place the dilator. Now, this dilator is going to create a path for our tubular retractor. And the whole surgery is done through the tubular retractor. Shot? Dr. B, how's he doing? Good. Now we're going past the esophagus, the trachea, using this dilator. Keep an eye on the guide wire, Jordan, for me. I don't see it. I don't want to see it advancing. Shot? Huh?
I think the guide wire moved slightly.
All right, but I see it in the center of the disc, right? Yeah, I think we're fine. By the way, this surgery, we lose about a drop of blood, maybe 5 drops maximum, This is bloodless surgery. So there's no need for transfusions, no need for hospitalizations. We are now at the front of the disc. You guys see that?
Yes, we do.
AP? Good. We have made our way through all the soft tissues, and we're going to bring down the tubular retractor over the dilator next. All right, look where the tip of the dilator is, folks, on that picture. Jordan will show you. It's perfectly in the center of the spine. That's where we want to enter the disc, in the center. Now show us the dye from the discogram and how it's leaked out around the nerves through tears in the back of the disc. Those are called posterior annular tears. That's where all the neck pain comes from, and that's where the herniation goes out. So we're going to go to the back of this disc with a little tube. We're going to find the herniations and the tears, and we're going to remove them. Beautiful. All right, I can feel the ALL, anterior longitudinal ligament. I could use a little inline, Dr. B, if you don't mind. Oh yeah, there we go. Good. All right, we are in the disc beautifully. I'm going to advance just a little bit because it's so easy to do. Shot. You can see the tip of the dilator is right at the tear. Show us the tear. You see that, Henry, that little tear, the black line?
Yes, we do.
And then you see the tip of the dilator right there.
Yes, we do.
It's perfect. So we're going to keep advancing using little taps. This looks barbaric, but this is the best way to do this procedure. This hammer was designed, it's called a mallet, for this exact application of advancing the dilator to the back of the disc. The other option would be to push on it, and that could be very dangerous because the resistance could give way suddenly and then you're in the spinal cord and you don't want that. So this is the safest way to do it. A lot of people comment about it. Oh my gosh, it looks so bad. Beautiful, everything's going well. This whole surgery will be done through this tube. You guys see this?
Yes, we do.
4 millimeters, that's it. No need to open your neck up, no need for scar tissue or bleeding or hospitalization. All this is done outpatient. And we've been doing it outpatient for 18 years. All right, the dilator moved back a little bit. You guys see that?
Yes, we did.
It moved back towards me. Shot. And the reason for that, anybody know? Pressure from inflammation. Dr. Berndes is right, Nikki's right. So there's so much inflammation in this disc from that tear and herniation, the body is trying to get rid of it, that there's pressure in the disc, like a tire under pressure. But it's hydraulic or hydrostatic pressure. And so when we fix this disc, that pressure will be gone. It'll go back to a normal pressure. Just trying to get my dilator down, my tube down, dilator. Just about there. There we go. All right. Sometimes it gets caught up on some fascia. Show us the tip of the dilator at the back of the disc within the tear. Show us the tube at the front of the disc. Good. So people say, Dr. Deuk, aren't you going to damage the disc? Nope. Because remember, the dilator tip has spread the fibers, spread them apart. Just like you put a pin in your shirt, the pin doesn't cause damage, right? It just goes through the fibers of your cotton, of your shirt, shot, and it pushes them apart so you can put the pin in. But when you take the pin out, there's not a hole in your shirt, is there? Nope. That's because you're not creating a hole, you're just spreading the fibers. That's what we're doing. Shot? All right, very good. So we are at the back of this disc and we're done. We're going to go in and start our endoscopic part of the surgery. Henry, why don't you show our audience all the causes of neck pain, folks. There are 30 potential causes of neck pain. That includes the discs, the facet joints, both left and right, and the muscle. And the muscle only causes pain from muscle spasms secondary to a disc problem or a facet problem. There's also fractures, tumors, and infections, which are very rare. But about 99.5% of neck pain is caused by either a disc problem or a facet problem or both. I'm Dr. Deuk Majan, CEO and founder of the Deuk Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3. Next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Deuk plasma rhizotomy is the best treatment in the world available for painful facet joints. Deuk Laser Disc Repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. Welcome back. So, from our video, you can see there are 30 different causes of back pain. The most common, neck pain. The most common is a disc herniation or disc injury. We have different names. Look at that herniation right there. We have different names for disc herniations, but they all mean the same thing. Whether you call a disc herniation a bulging disc, which is a small herniation, a ruptured disc, a slip disc, a protruding disc, an extruded disc, a spondylitic disc, a degenerated disc, they're all basically the same problem. And this surgery you're watching right now is the best treatment in the world for those disc issues that cause pain. Now, the discs cause pain 90% of the time in chronic neck pain. That was information that we discovered here at Deuk Spine Institute. And the facet joints are about 9%, let's just say 10% of neck pain as the primary cause. Now, what does primary cause mean? Primary cause means it's the main cause of pain, the number one cause of pain. Okay? So if somebody has disc pain and facet pain, the primary cause would be the main cause of pain. And the way we determine that is we ask the patient, where is your main pain? Where is the main problem? And they will tell you. Okay? It's not something you can see on an MRI scan. You have to ask the patient. The patient must be able to tell you where their pain's coming from. That is the key. That is the secret. That is our secret weapon. Our secret weapon in fighting chronic neck and back pain is the patient. And it's their physical exam, combined with their diagnostic imaging, which is the MRI, X-rays, CAT scans if needed, and nerve tests if needed. But we use those diagnostic exams combined with, there was a herniation sitting in the foramen. Do you guys see that?
Yes, we did.
are at the back of the disc, and what you're seeing here, right there, is the neural foramen, where the nerve is. It exits there and goes out to your arm. Now, he has numbness and tingling in his left arm. And when I examined him, because he's from Colorado, when he showed up and did his physical exam, I discovered that he has not just a pinched nerve in the neck, but also pinched nerve in the elbow, called ulnar neuropathy. Ulnar neuropathy. So pinched nerve in the elbow will not get better with this surgery, and I told him that, and he understands. But to be honest with you, there's lots of surgeons that do pinched nerve in the elbow surgery, but we are the only ones in the world that do this endoscopic surgery. So he can go back to Colorado and have his pinched nerve in the elbow surgery done by a local surgeon if he wants to, or I can do it for him. It's up to him. But we're not doing that today. These are all pieces of herniation coming up. The laser is used to free up the pieces of herniation, which are typically scarred down to the back of the annulus or the disc. We're seeing a little bit of bone spurs in here as well. There's a piece right there. You see how nicely the laser cleans it out? Any questions from our audience so far?
At this moment, no current questions. So in the meantime, why don't we show the audience of how a herniated disc causes neck pain?
I think it's a great idea. The most common cause of neck pain, folks, is a herniated disc. Remember, 90% of chronic neck pain comes from a disc herniation. So we're going to show you how that happens.
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Welcome back. You can see from our video animation that the way a herniated disc causes neck pain is through the tear in the back of the disc called the posterior annular tear. And that tear gets filled up with nucleus pulposus, or disc material, nuclear material, which is the herniation that we talk about. The herniation is actually the nucleus pulposus trying to escape. And that herniation or nuclear material causes the body to attack in a process called inflammation. That's how your body tries to heal things. Whether you have a fracture, whether you have a pimple on your face, or whether you have an infection in your body. The body tries to heal by first attacking and removing what it considers to be bad tissue. And the bad tissue in this case would be the nucleus pulposus, which is your body inflammatory system sees it as a foreign body, something that shouldn't be there, and it's right, it shouldn't be there. But it mounts this very powerful inflammatory response, which then, this is a piece of herniation, by the way. We're taking it out the tube. When you see me do this, I'm literally floating with the irrigation, the water in the tube. I'm floating it up and out. Okay, that's how we get these pieces out. We use hydrostatic pressure. We use water flow to get them out. It's one of the secrets of our technique. It also keeps the laser and the tissues nice and cool. That's why the laser is such a safe way to do this. Because if we didn't have this liquid here, it would be burning tissues. So you read online about surgeons and people commenting on laser spine surgery, and they try to make people afraid of it by saying your body could catch on fire from the laser, but it's nonsense. That just shows that they don't really do this surgery. They don't know how to do it because they're feeding misinformation. This is the age of misinformation, and that's the misinformation they're feeding you. Don't believe it. Any questions?
Yes, we have a comment and a question. This comment is coming from Big John on YouTube.
Big John paid us a visit, by the way. Big John was just here in Florida, and he came by and did a testimonial.
Yes, currently editing that.
Have we released Big John? I don't think we've released
No,
this testimony.
I'm currently editing it. It is in the process, and we'll have it done by next week for sure.
Yeah, sorry, Big John. We don't have your testimonial up yet, but thank you so much for coming back after 6 months and telling us how much you love Deuk Spine and sharing your experience for others to learn from. But yes, Big John will take your question and comment.
Comment saying, good morning. This patient has nice fluffy herniations, not like an old crusty calcified patient that I know.
Yeah, you're right, Big John. But he also has some, this is calcified right here. So right there is a little piece of herniation that is calcified. So what do we know? He's got both fluffy herniations, which are newer, and he's got the old calcified stuff. I would put this disc injury at about 15, 20 years minimum. Okay, now it could be older, but if I had to age it, I'd put it at about 20 years, 15, 20 years. Okay. Now, that's the original injury, but the newer herniations, the fluffy stuff you're talking about, is within a couple of years. It's about 3 years old. So what I think happened, he had his original injury many years ago. He had probably some symptoms that went away, and then he added to that injury and got more herniation. That's the newer stuff 3 years ago. That's when his symptoms recrudesced. And this is all scar tissue right here, right on top of the spinal cord. Very bad. This is all evidence of chronic inflammation, what we talk about in our video. Any question from Big John?
No current question from Big John, but we do have a question from, forgive me if I mispronounce this name, Munya Radzi on YouTube.
Munya Razi. Okay, YouTube. Very good. Let's take it.
Asking, just wondering why you call it laser repair and not discectomy.
It's not a discectomy. Yeah, this is the Deuk Laser Disc Repair. We are repairing the disc, not removing it. Discectomy is a removal of the disc. Ectomy means to remove. Discectomy means to remove the disc. This is not a discectomy. This is a annular debridement and a herniectomy, which means removing the herniation, but not a discectomy. Yep. Good question. Fair question. Hopefully that answers it. All right, Henry. Well, let's show the audience when people do get facet joint pain. Why do they get that facet pain? And by the way, did we show the video on the DLDR yet? How we repair it?
No, not yet.
Let's do that first.
Of course.
So we've seen how these discs cause pain and symptoms through a tear that gets filled with herniation, and now we're going to show you how the laser can be used to remove those herniations and repair the disc. All right, and maybe once you watch this, you'll understand this is not a discectomy. This is an annular debridement. And there's the tear right there. You guys see the tear?
Yes, we do.
Literally, it's torn right through the posterior longitudinal ligament, PLL. Okay? Here's some scar tissue still within the disc, but that is the tear. And you see the blue stuff in there? That's herniation. So I've got to open the PLL. This, by the way, the view you're seeing here, 99% of spine surgeons never see this good, ever. They can't even see any of this in the back of the disc. That's why so many spine surgeons leave the herniation there, because they can't see it. The only reason we can see this so well is we're using the endoscope, and they don't use endoscopes. We are the only doctor in the United States that does endoscopic surgery like this through the disc to see the tear and the herniation.
Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debrides the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
And welcome back. You can see from our video how the laser and endoscope are used together to be able to perform the Deuk Laser Disc Repair. The Deuk Laser Disc Repair is the most advanced surgery in the world for a disc herniation. It is the best surgery for patients, not the best surgery for the companies that sell metal implants because we don't use any, and not the best surgery for most spine surgeons because they don't know how to do it. Oh, look at that herniation. It just came out of the foramen on the patient's left at C5-C6. Big chunk. That was sitting right on top of his nerve root in the foramen. The foramen is where the nerve root is. The nerve root is where the nerves are that go down your arm. And the beauty of the laser is twofold. It releases the herniation and it also jiggles the herniation. What is jiggling? Well, jiggling is important. It's hydrostatic pressure. It's like a pressure washer, right? If you take a hose and you try to wash something off your car, it doesn't come off. But if you use a pressure washer that uses high force, high pressure, then that dirt will come off your car better, or love bugs, whatever it is. Look at that piece of herniation right there in the foramen. It's beautiful. Let's go get it. Any questions?
At this moment, no current questions.
Once again, 99.9% of spine surgeons, they don't know how to do this surgery. Okay, it's futuristic for them. They don't even know it exists. It's like a country knowing about a stealth bomber or not knowing about a stealth bomber, the most advanced bomber in the world. Just because the country doesn't know about it doesn't mean it doesn't exist. Of course it exists, but it's just not available to everybody. And you have to have the technology to be able to use it. Well, medicine's the same way. At Deuk Spine, we have the most advanced spine surgeries in the world. We perform them every week. If you want the best spine surgery in the world, you come to Deuk Spine. Okay, we're just about done. I've got to try to get a little bit more of that. I'm really reaching out in the foramen. Some of this is just calcified ligament. Any questions?
At this moment, no current questions. So in the meantime, why don't we show the audience of how it is facet pain is caused?
Sure. The second most common cause of neck pain and back pain is the facet joints. And the facet joints are located on the sides of the spine in the back of the spine. And they are very common cause of pain. They may not be the primary cause of pain, more than 10%, but they are the most common secondary cause of pain after the disc. And about 45% of patients have facet pain when they present to the doctor with neck pain that's chronic. 45%, okay? That's it. We're pretty much done. I think we've gotten all we can get. I'll try a little bit more. But the foramen looks clean. Looks good. All right, let's check the other side. Remember, this is 5-6. We still have to do 6-7. But we're almost done with 5-6. We've had zero bleeding. Our patient is completely asleep for the surgery. Once again, he comes from Colorado. He's actually here with his wife. She's in the waiting room waiting for him, and she's actually watching his surgery right now as we speak. All right, looks good. Yeah, we're done. We're done here. I've cleaned out everything I can. I just want to take one more peek here. A lot of scar tissue down there, but it looks pretty good. I'm pretty happy with that. And remember, this is all scar tissue. It's from chronic inflammation. I just want to make sure there's not a herniation. This is called the posterior longitudinal ligament. You can see the fibers. They're kind of running left and right. Let's just take a look here.
Before we do the video, we do have a question
Sure.
coming from Lanu on YouTube,
Hi, Lanu.
asking.
Oh, look at that herniation. It just came out.
Oh, we
Big
see.
one.
Yes, we do.
Big one. Oh, mama. Look at it. It's calcified. Not completely calcified, but it's partially calcified. That's what all that gold color is. All right, I'll take Lanu's question.
Asking, to cure back pain can cause
Look at
age
that.
reversing. Some people feel young again. Is this true?
Some people feel what? Young again?
Young again.
Absolutely. Yes, when you cure pain, folks, you're going to feel amazing. That's what we do at Deuk Spine. Our patients do very well if they do what we tell them to do. But I will tell you this. The average patient has 4 causes of pain. 4. Okay? And if you don't fix all 4 causes, you're not gonna have 100% pain relief. You're gonna still have pain. So we do have some patients who choose not to do all their causes. As a matter of fact, 20% of patients who have chronic back pain or neck pain, they have 7 or more causes for back pain. 7 or more causes. Think about that. So you got like 3 discs plus 4 facets. That's 7. Or it could be 2 discs, 2 facets, and a piriformis and an SI, or 2 piriformises. There's so many combinations. The point is, if you don't treat all the sources, you'll never get rid of all the pain. So at Deuk Spine, we're able to diagnose 99.5% accuracy and all the sources of pain, and we're able to cure all of them except for infection, which we don't treat. And infection is rare. Watch out for that. Thank God. Infection and tumors like cancer, very rare, far less than 1%. So 99% of the causes of neck pain we can cure. The only thing we can't cure is a deconditioned muscle. What is that? So if you have facet pain or disc pain for years and you don't use your neck or back properly, you're not getting the exercise you need, the muscles shrivel up, they atrophy, they get weak. And unfortunately, when you have a weak muscle, it hurts. As a matter of fact, it could start hurting 20 minutes with activity, right? So the point is that to get rid of pain completely, you have to not just get rid of the source, but also recondition your muscles. And some people have very deconditioned muscles. We can't do that surgically. It takes therapy. Okay, you can see we're at the back of the disc. Now, we need to get everything lined up perfectly, and we're going to move. Is he still relaxed? We're going to move down 1 level. All right? What is that right there? Shot? There, it moved. Was that your hand, Luis? That's good right there. That's good. All right, guys, we're ready to do this, okay? Everybody ready? I'm going to start by taking out the tube, but leave the dilator. Shot. All right, there's the dilator. Tube's coming out. We call this the Deuk slide, the Deuk spine slide. Shot. Or is this the shuffle? This is the slide. All right. Hold on. Shot. I got to make sure things aren't moving in a bad way. Take that. We're going to put this here. Now, we got our dilator in position. Shot. And I got to move south 1 disc. You guys ready? Here we go. Coming out. Should be out now. I'm out. Shot. And we got to move down a little bit, but I got to check my front back view to make sure I haven't moved to the side. We are the first in the world to do this. Shot. At Deuk Spine is perfect. We're right in the middle. Lateral. So the issue is, as we move south, let me have that. We're doing it with the X-ray guidance. So I have to use the X-ray. You guys ready? Okay. I'm going to move the rest of the way. Shot. Almost there. And shot. Yeah, we're right on the precipice. And shot. Perfect. We're in perfect position on the lateral. Let's go AP. Everybody don't move. We're almost done. I promise. I'm sitting right in the front of the disc. Shot. All right. A little bit to his left. I have to correct that. Shot. And I corrected, but I went north. Wait. Shot. Uh-huh. Yeah, I went north a little bit. Let's go back to a lateral. If you have questions, type them up. Shot. All right, yeah, I went north a little bit, so I have to come back south. Shot. And that looks really good right there. Let's go lateral, AP I mean, make sure. I'm always doing a double check because it's too important. You don't want to make a mistake here. That's perfect. We're right in the middle. Now, I'm going to enter this next disc, 6-7 through the front. I'm going through the annulus shot. And once I get in, I'm going to redirect. I'm going to aim up. I'm aiming up. There it is. And the reason is 6-7 is the hardest disc to do. Pipe cleaner. I'm going to do a discogram next. But I've got to clean the barrel of this dilator out. Otherwise, there's a little bit of nuclear material in there, potentially. Any questions? Shot?
At this moment, no current questions.
Shot? All right, then in that case, we've shown the video on DLDR. We've shown how does a disc cause pain? How does a facet cause pain?
Correct.
Shot?
We have not how a facet cause pain yet. No, we have
Oh, I
not.
thought we did. Okay, let's do how does a facet joint cause pain? Shot?
Copy that.
And then after that, shot? Is that it? Then after that, let's do how we fix facet pain. Shot?
Copy that.
Almost there.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Welcome back. You can see from our videos that the facet joint, which is the second most common cause of neck pain, about 10% of neck pain as a primary cause and 40% as a secondary cause, is from facet joints. And the way we fix that permanently is with our Deuk plasma rhizotomy. We're the only ones that do it. It has been peer-reviewed, patented by the United States Trade and Patent Office. You are watching the future of spine surgery. New surgery called laser spine surgery, Deuk Laser Disc Repair. We've been doing this surgery now for 18 and a half years, almost 19, and at Deuk Spine Institute. And we've done over 2,150 patients at this point in those years. The patients we did 18 and a half years ago are still doing very well. Our re-herniation rate, in other words, once we fix your herniation, the chance of getting it back is 1%. That's the actual number of patients. So in 2,150 patients that we've treated, we've re-herniated in 22 patients. So I've tried to avoid it, get away from that number and make it better over the years, but I haven't really been able to. The truth is, it's not really because of the procedure. It's because of what patients do. 5 minutes, Dr. B, 5 minutes. The patients that follow our instructions after surgery are the ones who do not reherniate. The ones that do not follow our instructions generally are the ones that reherniate. That remains true 90% of the time. About 10% of the patients will say, I don't know what happened. I didn't cough. I didn't sneeze. I didn't lift anything heavy. I just woke up from my sleep and I had the herniation symptoms back again. And so those people reherniate at night while they're sleeping, tossing and turning in bed. Great job, Luis. This is a very old herniation, by the way. All of this is scar tissue from chronic inflammation. So the body has been attacking this herniation for a long time. Now, if you ask me, I would say that the other herniation, number 5-6, this is 6-7, number 5-6, the one we did first, that's the one causing most of his pain. Why do I know that at this point? Because look how, this looks like kind of an old burned out war zone. Oh, still more herniations coming out, beautiful. But I don't see any active inflammation. This is old inflammation, and thank you. And so it's kind of like, you know, right now there's a war going on, and I hate war. I think war is the worst thing in the world. People dying, people scared and fear and suffering. It's just horrible. But sometimes wars are necessary. I'm not saying the wars we have now are necessary. I think there's better ways to resolve conflict besides war, you know, economically. But the reality is, when war does happen, you have destruction of cities. And this is the same thing that happens with a herniated disc. What's destroying this area here is your own body. It's called your inflammatory system. It's like an army coming in and shelling an entire city and destroying it. So this disc to me looks like it was shelled a while ago, like years ago, not recently. That's why I'm saying this is old, calcified and scarred up, okay? If you want to know where the new action is, you look for smoke, you listen for sounds, you figure out where is the army shelling now. And that was the disc we just fixed, number 5-6. This is old. Still needs to be repaired, but it's an old injury. Any questions?
No current questions, so we do have a comment from Big John saying to me, Henry, I have to run. I'll catch you guys down the road. I told him that not a problem. I'll keep it posted with the testimonial for next week. And he says, can't wait.
Yeah, thanks, Big John. We're a little behind on our testimonials, and we have a hurricane coming to Florida in 2 days, which none of us are looking forward to. By the way, this right here is sitting on his nerve, crushing his nerve. So I wonder if he's going to get some good relief when I fix this area. This may not be a neck pain area. This may be an arm numbness area right here. That's a lot of scar tissue and herniation just kind of sitting on the nerve. Now, other doctors can't do this. You guys see that glass fiber right there?
Yes, we do.
How wide do you think that glass fiber is? That glass fiber right there and the laser tip. It is 1/2 millimeter, 0.5 millimeter. That's how small this is. So the problem is, if you're not using an endoscope, like a high definition endoscope to do your surgeries, you can't see that fiber. You can't use a naked eye or even a microscope really to see it. So this surgery that we're doing is quite unique. There's only myself in the United States that I know that does it in the neck. And that's because doctors are not trained to do this kind of work for the most part. They are, unfortunately, trained to do fusions instead. And fusions are totally unnecessary.
5 minutes?
No, 2 minutes. No. Totally unnecessary. No need for fusions or artificial discs. The problem is, folks, that the entire medical industry is controlled by companies that profit from fusion by selling those metal that goes in your neck, or the bone, cadaver bone that goes in your neck, okay? They want surgeons doing fusions. Their fusions are paid at the highest rate of all spine surgery. Fusions and artificial discs just behind them. What do you think, Luis?
You want to switch?
I don't know. Let me just see how we do here. And so doctors, surgeons are incentivized financially to tell you to get laminectomy, discectomy, fusion, artificial disc. That's not what's best for you, the patient. That's what's best for them. And they're never going to tell you the truth, ever. I will tell you the truth because I used to do fusions all the time. I've made a lot of money doing fusions in my career, a lot. I was a very good fusion surgeon. I was so good that I even published my data, and I did those fusions outpatient. And I still do, by the way, once in a while when it's necessary. Now, we were supposed to do a cervical fusion on Thursday, but because of the hurricane, we had to move that surgery to Tuesday of next week. So why are we doing a fusion? Because she's already had multiple fusions on her neck, and the surgeon that did her fusion did a horrible job. And she has what's called a deformity, kyphotic deformity above and below the fusion, because he didn't do the surgery the right way. And now she needs an additional fusion for adjacent segment disease. So she's had an ACDF, she's had a PCDF with screws and rods, but they stopped the PCDF at C7 or C6, and now I have to extend it down into T2, actually T3 in her case. So we're going to be doing a highly invasive fusion next week, surgery on a patient who's coming from Texas to get it done. So you guys can watch that. It's going to be interesting. We're going to take out the old screws and rods, and we're going to put in new screws and rods and try to correct her deformity. Okay, we're done. We've cleaned out the back of the disc as much as we can. And I'd like for you all to type up your questions. I'll come and answer them for you. But I want you to notice the entire surgery for 2 discs was done with a 4mm incision on a very thick neck on a very difficult case. One that most surgeons wouldn't even try to do an open surgery. It's much easier to do open surgery. ACDFs are easy. Easy. I can do an ACDF blindfolded. These surgeries are far more sophisticated and difficult to do, the endoscopic surgery. All right, if you have questions, type them up and I'll answer them for you. Otherwise, Henry, let's show the audience one more time how the Deuk Laser Disc Repair works.
Of course.
As we're removing the tube and finishing the surgery.
Copy that.
Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debreeds the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
And good morning, I'm Dr. Deuk Majan, CEO and founder of the Deuk Spine Institute. I'm here with one of my patients who's traveled far to come to Deuk Spine Institute, all the way from Michigan. What brought you from Michigan to Florida?
I was scheduled for fusion to have just my one disc, C5-C6 fused. I'd had disc herniation before in my lower back, had it done. I didn't want to have to go through that again, so I did some research. Found you had good record. Your history is impeccable, so I decided to come down here and have it done.
Well, you didn't have a fusion though. You had something else done.
Yeah, I'm sorry. So instead of fusion, instead of going through and the complications and risk of fusion, lack of mobility, I wanted to have laser. I talked to somebody in Mexico that had laser surgery, and she said it worked great. So I thought I'd pursue that avenue, and that's when I kept Googling and searching and trying to find the right place. Some places had bad references. You had impeccable record, so this is why I came here, and I'm glad I did.
Yeah, so you were recommended for fusion by another doctor, and let's talk about that for a moment. They were going to fuse one disc, right? Number 5-6?
Correct.
Now, if you go to your surgery video here, you could see that we made a tiny 1/4 inch, 4mm incision, and we fixed 2 discs, not 1, but 2. And it turned out that the disc that you were not going to have fused was actually the worst one. It was the one that was causing the vast majority of your symptoms. And the reason I'm talking about this is it's a common problem. It comes down to being misdiagnosed. And misdiagnosis happens all the time, all over the world with spine problems. And that's what we're trying to fix, is not having patients get the wrong diagnosis, because the wrong diagnosis will lead to the wrong treatment. Because treatments are always based on diagnosis. So if your diagnosis is C5-6 disc, the treatment will be fusion of the C5-6, but that's wrong because you had 2 discs that were problematic. We fixed both. You could see in that video, we were taking out lots of little chunks of herniation out of your C6-7 disc. Definitely needed to be done. How do you feel today?
I feel great.
Yeah, do you still have the same neck pain you had when you came here?
No, my wife can already tell that my shoulders are relaxed. My neck, I feel great. Feel very comfortable.
And you had your surgery just 24 hours ago.
Yesterday morning.
Yep, and you can see you have a tiny 4mm incision with a Band-Aid. No metal, no fusion, no narcotic painkillers after surgery. We didn't give you opioids, so that's another plus to the Deuk Laser Disc Repair.
I agree.
Yeah, you don't need to be on powerful painkillers. You're back on your feet already, walking around, not in the hospital.
Yep, great. I'm glad I had a guardian angel looking after me.
You did have a guardian angel, and you're welcome. We people like you have successful spine surgeries. Is there anything else you want to tell your fans out there?
Basically, if you need this surgery, if you're having complications, neck, back, definitely come here. I don't care what it costs you for travel or whatever. You can't, it's worth, priceless.
I agree with you. It is priceless to get out of pain and have no complications from your surgery, and nothing bad that hurts you or harms you or changes your life in a negative way. So congratulations. And when do you guys head back to Michigan?
Saturday.
Saturday. So you're going to spend a few more days here?
Yes, sir.
What are you going to do for the next couple of days?
Well, we plan on hanging out in the sun, but
yeah,
it's not the case right now.
I think, yeah, well, you could do. Oh, yeah,
enough
it's a
sun
little overcast right now. But this would be a good day for you to go check out the Kennedy Space Center. It's about 10 minutes away. They have all the displays and history of NASA, and it's really worth visiting.
I'll do that.
Save the beach for tomorrow.
There you go.
Sunny day.
All right.
All right,
Thank you very much.
congratulations. You're
Thanks,
welcome.
Thanks again.
I'm here with my patient who traveled from California, Northern California. He had a herniated disc at C5-6. It was a small disc bulge. He was told by the doctors in California that he should just live with the pain, give it time, and eventually he'll need a fusion. Is that right?
That is correct. I was told that within 5 years I would be needing surgery. So basically what they were saying, live with pain for 5 more years and then we'll do something about it. One of the things that I've seen a lot of the videos is testimonials, and I will always say, this doctor sounds too good to be true. And actually it is true. I appreciate you, doctor. I really think that is really nice procedure, and the staff here is really nice. They're always very friendly and kind to get you through the process, because when you get told so many times that that's your new life, it's kind of, you're always thinking, is really the way I want to live? If I'm going to live a lot of years, why wait with pain? You know, you need to do something different. And always, whenever you see videos, you're always a little sketchy and saying, maybe it's not true. Maybe this is not what it is really saying. But today when I felt with no numbness and no pain on the neck and just going through the process, I really been blessed. I'll be flying to California today. I honestly can't say much, you know, it's a miracle. Whenever I heard the testimonials, they say you're a tool for God. It actually seems like that's the way it is. It's a miracle through you. God works through you, and it's awesome to feel better, you know?
I'm so happy for you and your lovely wife who's here with you. You can see you had a tiny little incision. You had the Deuk Laser Disc Repair for your herniated disc. You can see we were in there with the laser, cleaning out that foramen on the right side where the nerve was being pinched. There were a lot of pieces of herniation in there. And the laser cleaned them all out, and your surgery went perfect, and here you are less than 24 hours later. Feeling good, huh?
Well,
With
yeah.
a smile on your face. That's what I like to see.
You know, it's a smile of happiness. It's a smile of joy, you know, that it is doable. And I think no one should be able to be living with pain. I was so happy to see testimonials when they used to say, well, the one regret I have is not going in earlier and living 18, 20 years with pain. For me, it's been 3 years since July of 2020. It's been miserable because I've been with pain. And I've been told by doctors, let's just take time. I did all kinds of physical therapy, acupuncture, you name it, everything that's out there, and nothing seemed to help. And today, with 1 day of getting something really that's gonna be for life, it's amazing. It's a smile of joy, you know? If you are going through this trouble, don't hesitate on sending your MRI. When I did it, I sent my MRI for free review, and my answer was, yes, you are a candidate. Here I am today, flying back with literally no pain on my neck and no numbness on my hand, which I miss that. It's awesome.
It's wonderful. Now, what is your native tongue? What is your native language?
It's Spanish.
Are you from Mexico originally?
Guadalajara, Jalisco, Mexico.
Guadalajara.
Yes.
One of my favorite songs. Can you tell them in your native tongue how you feel?
Yeah. Quisiera decirles que si están teniendo problemas con una hernia en su cuerpo, manden su MRI. Es gratis y les van a dar un resultado, una verificación si ustedes son candidatos. No vivan con dolor, porque el dolor les va a causar toda la vida, y los doctores allá afuera les dicen que no hay solución, pero las soluciones existen, simplemente las tienes que buscar y creer, tener fe que tú vas a estar mejor. Si Dios te mandó a este mundo es para que vivas bien, no para que vivas con dolor. Así que te recomiendo que por favor tomes esto en serio, hagas ese paso de mandar tu MRI gratis y habla ya sea con quien tengas que hablar para que ellos te empiezan a guiar y te digan qué es el siguiente paso que tienes que tomar. Así que una recomendación con Dr. Deuk. Muchas gracias.
Muchas gracias, amigo. And Feliz Navidad.
Feliz Navidad. Gracias.
Safe travels, my friend. Thank you so much for sharing.
Okay, great testimonial from one of our patients who underwent surgery here at Deuk Spine Institute. If you know somebody who's having neck pain or back pain, come to Deuk Spine. We're the ones who can fix it for you and get rid of the pain. Remember, if you have 5 different causes of your back pain, we got to fix all 5, and that's very common. The most common is 4, the average is 4. The average patient with chronic back pain or neck pain has 4 specific causes of pain. The reason why doctors fail to cure people of pain is because they don't know what those causes are. The doctor doesn't know the causes. The doctor hasn't diagnosed all the causes. Doctors are looking at the MRI for the diagnosis. The MRI will never tell you where pain comes from, ever. Go look at your MRI reports if you don't believe me. Read the report, impression, whatever it says, findings. Do you see where it says the pain is coming from here? No, because it doesn't. Radiologists don't know where pain comes from. They're the ones reading it. And doctors don't know where pain comes from either. But it turns out, if you've watched this surgery, that the pain actually comes from a tear in the back of the disc about 90% of the time. And that's what we fixed in this patient. So here's his disc. We took it out from the spine. And by the way, somebody asked about a discectomy. Are we doing a discectomy? No. A discectomy is where you take the whole disc out and you put something metal in there, like an artificial disc or a piece of metal and plastic. Another example would be this metal plate with, whoops, with the cage in front of it, okay? Who wants a piece of metal in their spine? The other option is to do it in the back of the neck with screws and rods, okay? These are all called implants, spinal implants. Spinal implants are big, big business, big money. And that's why the doctors are pushing it. That's why the companies that make those implants are pushing it, because they know if you get that surgery done, you're going to keep coming back for more surgery. At Deuk Spine Institute, we don't want you coming back for more surgery. We want to fix you once and for all. We have a very different philosophy, okay? So here's your disc. Take it out. Look at the back of it. There's a tear with the jelly stuck in the tear. That's the red stuff stuck there trying to get out. That's where the inflammation and pain comes from. That's what I discovered at Deuk Spine Institute 18 and a half years ago. We published our surgeries and our results about 12, almost 13 years ago for the first time. Actually, almost 14 years ago now. So we've been doing this surgery now 18 and a half years. The success rate of getting rid of pain is 99.6% from the disc. Pain from the disc, when we operate on the disc with this surgery, 99.6 is the average amount of pain that is gone from the disc. Now, if you have facet pain on top of disc pain, we're not getting rid of the facet pain unless we treat your facets. The next surgery we're doing, the very next surgery after this, if you join us again in about 20 minutes, we have a facet pain patient who comes from Bradenton, Florida, and their facet joints are the cause of their pain. They have 4 facets causing pain. I recommended fixing 4 facets. They chose just to do 3, and I think it was a financial decision, but we're going to fix the 3 worst facets, okay? So our next surgery will be a Deuk plasma rhizotomy, treating facet pain on the left side. This surgery was 2 discs in the neck. This patient, by the way, has 3 discs that are herniated. We just fixed 2 per his request. Any questions?
Yes, we do. We have 2 questions, both coming from Lanu, once more on
Hello,
YouTube.
Lanu.
First question they asked, have you ever aborted a surgery due to an unexpected discovery or a dangerous situation?
Great question, Lanu. The answer is yes. I have had to abort surgery, although it's very rare. As a matter of fact, in the neck, I had to abort a disc because I couldn't get to it. The neck was so thick, the disc was down at the bottom, C6-C7, and the collarbone, right here, the collarbone blocked me from getting in. Now, if you look at this patient, his collarbone almost blocked us from getting there. I had to rest my tube up against the top of the collarbone because the collarbone was so high. And the trajectory or angle to 6-7 was like down to up. So in the front of the neck, it was up against his collarbone. So I had to abort in my entire career of doing laser surgery on the neck. I had to abort 1 patient. But I got the other disc fixed. I just couldn't get both discs fixed. So I had to abort 1 disc. The patient did fine. It turns out that the other disc wasn't as problematic and symptomatic as the one I fixed, probably because it wasn't moving very much. I also had to abort in the lumbar a couple of L5-S1 discs over the years, probably 2 in the last 18 years I had to abort. That's about it. You know, I would say 99.999% of the time we get everything done. Yeah, good question. What's the other one?
Next question from Lanu asking, why is C5-C6 so common for herniated discs?
Great question, Lanu. So C5-C6 is the most common disc herniation to cause symptoms and need surgery. It is. 6-7 is the second most common, C4-5 is the third. Why is that? And the answer has to do with a lot of things, but mostly it has to do with basically anatomy, the way the body is structured. So if you look at what's called the plumb line, which is a line that shows the weight of the skull, how it passes through the spine, that line runs right to the back of the C5-6 disc, and that's why plus 6-7 is more supported by the shoulders. It gets more stability, and everything below that is more stable. So it's kind of like 5-6 is the highly mobile joint just above a very stiff section of the spine, which is 6-7-7-1. And so When you have a highly mobile part of your spine that's attached to a very stiff part, that area wears down faster.
That is it for questions.
All right, I hope you enjoyed the surgery. I'm Dr. Deuk Laser. I'm here with Henry, and we really enjoyed our live stream. We'll be back with you in about 20 minutes for the next surgery. It will be a Deuk plasma rhizotomy for facet joint pain. Forget about medial branch block. Forget about radio frequency ablation. Those treatments don't work and they don't last. People keep getting them done over and over again because that's all doctors know how to do. But you are bringing that doctor money. Every time you come back, you're making money for the doctor. We're not interested in you coming back. We don't want your money. We want to fix you once and for all. We just want to see you one time and do the procedure once. And that's what the Deuk plasma rhizotomy is. We'll have some good animations during the surgery. But basically, long story short, you're going to come in, get the procedure done, and never come back for the rhizotomy again because it's a